Ever wondered what actually happens the moment you sit down for a dentistry appointment? I mean really happens. Not the polite version the receptionist tells you, but the behind-the-scenes reality inside that bright chair with the mysterious tools and the humming sound. Today we're opening the curtain, and lucky for us we have someone who knows every secret of a dentistry appointment. Dr. Esma has said, Doctor, be honest, do dentists secretly judge people the moment they open their mouth?
Mr. Rasim, I promise we don't sit there scoring people's teeth like judges on a talent show. But I would admit something surprising. The first few seconds of a dentistry appointment tell a dentist a lot about your oral health. How your gums look, how you breathe, even how you sit in the chair, it all reveals clues. And most patients are shocked when they learn what dentists can notice before a single instrument even touches a tooth.
Wait, so before the scary metal tools even appear, you're already running some kind of detective investigation? That sounds like the opening scene of a medical mystery. And now I'm curious, what are the 3 things dentists notice first during a dentistry appointment that patients never realize? Alright, Dr. Esma, let me guess how most dentistry appointments really start. Someone walks in thinking it's just a quick checkup. 2 minutes later, they're lying in the chair wondering why the dentist suddenly went quiet. You know that moment, right? The dentist leans back slightly, tilts the light, and suddenly there's this mysterious pause. Every patient immediately thinks the same thing. Something is wrong. I've been there. You start replaying every late night snack, every skipped flossing session, every coffee you ever drank. A dentistry appointment suddenly turns into a full life review.
Rasim, that silent moment you're describing happens in almost every dentistry appointment. And patients instantly assume the worst. But the truth is, dentists pause because we are carefully observing. Sometimes we notice tiny plaque buildup, sometimes early gum irritation, sometimes perfectly healthy teeth. The problem is that many people come into a dentistry appointment already stressed, expecting bad news before the exam even begins.
That makes sense. But let's be honest, Dr. Esma. Most people don't fear the dentistry appointment itself. They fear the unknown. The sounds, the instruments, the feeling that the dentist sees things we don't. So now I have to ask the question every viewer is thinking, what are those small warning signs dentists detect during a dentistry appointment that patients completely miss? So basically, a dentistry appointment is like an early warning system for your mouth. And I think many people underestimate that. They assume the dentist only reacts when there is pain. But from what you're saying, Dr. Esma, the real goal is to catch tiny problems before they become big ones. Because let's be honest, nobody wakes up one morning hoping for a root canal. It usually starts with something small that was quietly developing for months, maybe even years, right?
Exactly, Rasim. During a dentistry appointment, we often detect things long before patients feel any pain. For example, early gum inflammation might only appear as slight redness, but if ignored it can slowly progress into serious gum disease. Another example is a tiny cavity forming between 2 teeth. A patient may feel absolutely nothing, yet the dentist can see the early stages during a dentistry appointment and stop it before it grows.
That really changes the way I think about a dentistry appointment. It is less about fixing damage and more about preventing it. And now I'm curious, Dr. Esma, when a patient first opens their mouth during a dentistry appointment, what are the 3 signals that instantly tell you whether someone has been taking great care of their teeth? You know, Dr. Esma, I recently heard something surprising. Apparently a huge number of people only schedule a dentistry appointment when something already hurts. Which feels a bit like waiting for your car engine to start smoking before opening the hood. By that point, the repair is usually bigger than it needed to be. Is that something you actually see in real life inside the clinic?
Very often, Rasim. In fact, many studies show that a large portion of adults delay their dentistry appointment until discomfort appears. I remember one patient who came in thinking he had a sudden tooth problem. But when we examined his mouth, the issue had actually been developing quietly for years. During that dentistry appointment, we discovered early gum disease and 2 small cavities that had never caused pain.
That's fascinating, because it means a dentistry appointment is not just a reaction to pain. It is almost like a routine health check for your entire mouth. And hearing that story makes me wonder something else, Dr. Esma. Are there certain habits dentists instantly recognize during a dentistry appointment that reveal how someone really takes care of their teeth at home? So, Dr. Esma, this is the moment where we get the real insider perspective. Because from the outside, a dentistry appointment looks simple. Sit down, open wide, dentist checks a few teeth. But clearly, there is much more science happening than people realize. I mean, dentists are reading clues from gums, enamel, even saliva. It almost sounds like a mini health investigation happening inside your mouth.
You are absolutely right, Rasim. A dentistry appointment is not just a visual check, it is a scientific assessment. Dentists evaluate enamel wear patterns, gum color, plaque distribution, and even how the bite aligns. For example, unusual enamel wear can reveal nighttime teeth grinding, while specific gum patterns may suggest early inflammation. During a dentistry appointment, we combine these visual clues with imaging like digital x-rays to see what is happening beneath the surface.
That's incredible, because it means a dentistry appointment is almost like reading a health report written by your teeth. And now I'm wondering something many viewers probably ask themselves right before opening their mouth in the chair. Dr. Esma, what are the first signs during a dentistry appointment that tell a dentist someone might be grinding their teeth at night? Alright, Dr. Esma, let's help viewers picture the whole process. Someone walks into a dentistry appointment, sits in the chair, and suddenly the bright light switches on. For people who feel nervous, that moment can feel mysterious. So if we slow it down step by step, what exactly happens first during a typical dentistry appointment? Because once people understand the process, I think the fear factor drops instantly.
Great question, Rasim. A dentistry appointment usually follows a simple sequence. First, the dentist visually examines the teeth and gums using a mirror and light. Second, we check gum health and look for plaque or early cavities. Third, if necessary, we take digital x-rays to see areas hidden between teeth or under the gums. Finally, the dentist explains the findings and recommends preventive care or treatment options. When patients understand this flow, the dentistry appointment becomes much less intimidating.
That actually sounds far more organized than people imagine. Instead of random tools appearing, a dentistry appointment is basically a structured health check for your mouth. And now I'm curious about something practical, Dr. Esma. What simple things can patients do before a dentistry appointment to make the visit smoother for both the dentist and themselves? Alright, Dr. Esma, let's talk about the little mistakes people make before a dentistry appointment. Because I've heard some funny ones. Someone suddenly brushes their teeth like an Olympic sport 5 minutes before walking into the clinic, hoping the dentist won't notice anything. Others skip brushing completely because they assume the dentist will clean everything anyway. So what are the real do's and don'ts before a dentistry appointment that people should actually follow?
Great question, Rasim. First, always brush and floss before a dentistry appointment. It helps the dentist clearly see your teeth and gums. Second, avoid eating very strong-smelling foods right before your visit. Third, be honest about any pain, sensitivity, or habits like teeth grinding. The biggest mistake people make during a dentistry appointment is hiding symptoms because they feel embarrassed. Dentists are there to help, not judge.
That honesty part is important, because if someone says nothing during a dentistry appointment, the dentist might miss clues about what is really happening between visits. And now I'm curious about something many viewers probably wonder while sitting in that chair. Dr. Esma, what is the one question every patient should ask during a dentistry appointment but almost nobody does?